Hello everyone, it's Dr. Jimmy here, and we are going to learn the overview of upper limb today. Recommended book is The Gray's Anatomy, 3rd or the 4th edition. Outline of today's topic. Let's talk about the general description. Upper limb is associated with the neck and the thoracic wall, suspended from the trunk with a small skeletal articulation. It could be divided into the shoulder, arm, forearm, and the hand. We got here the 3 transition areas in the upper limb. Here we can see here the green region is representing the first transition area of upper limb. We call that axilla. Let's see from the anterior view. The second transition area, cubital fossa. The third transition area, carpal tunnel. Functions. Upper limbs functions positioning the hand in the air. The hand as a mechanical tool. We can perform a lot of functions with it. And the hand as a sensor tool. We also feel. Let's talk about the movements of joints, especially in the shoulder part. Here the arrows are representing the movements performed by the shoulder. If you take the arm away from the midline and bring it back, or maybe we can say the angle here. This motion represented as abduction and adduction respectively. If you move your shoulder, especially the shoulder blade, the scapula, what we call that, forward, okay, we call this movement protrusion, and movement back, retrusion. Moving forward and the backward, the arm at the shoulder joint, we call this movement as a flexion anteriorly. In the middle, in the anatomical position, it will be the extension, and if you turn to the backward, then it will be the hyperextension. Some writer may consider as flexion and extension only. Here we can see from the front view abduction and adduction very clearly. Here, by bending the elbow joint, it will be very clearly visualized. Move inward and outward. We call that internal and external rotation of the shoulder joint. And this is the movement we call the circumduction. Let's talk about the elbow. Elbow movements, as it is the hinge joint, so it is performing the flexion and extension between the humerus and the ulna. But here at this position, proximally radius and the ulna also making the pronation and supination, as in that motion the radius head is moving over there. Here we go this motion. At the elbow joint, flexion and extension. The red arrow is representing the flexion and the blue is representing the extension. Let's talk about the movement at the wrist and the hand. We got here the abduction and adduction at the wrist, flexion and extension, and you can say a little rotation. For the fingers, the midline here as the axis, and fingers are performing abduction and adduction respectively. Flexion and extension for the fingers. Component parts. Upper limb is formed by the bones, joints, muscles, okay, in which rotator cuff muscles at the shoulder we have learned in the previous term too. So the bones, those that belong to the upper limbs, in which the shoulder girdle, we got here the clavicle, scapula, for the arm, humerus, for the forearm, radius and the ulna, For the wrist, carpal bones, metacarpus in the palm, and the phalanges in the fingers. Muscles. We can see the muscles are holding the upper limb attached with the axial skeleton. These muscles, what we can see in the picture, levator scapula, rhomboid minor and the major, trapeziums, and here is the latissimus dorsi. If we look from the anterior view, you can see here at the shoulder, this is the deltoid muscle. This is the pectoralis major muscle. If we look from the lateral view, you can see around the glenohumeral joint, or you can see the main shoulder joint, we go to the four muscles, one anteriorly, which is coming this part anteriorly, that is the subscapularis. Posteriorly, above the spine, supraspinatus, below the spine, infraspinatus, and here below this, that is the teres minor muscle. These four muscles are known as rotator cuff muscles because they make the cuff around it. Let's talk about the muscles compartments. Arm is the region that is starting from the shoulder to the elbow. So if we cut it, the transverse section, we will get the two compartments of the muscles and the one bone humerus. So anteriorly, this compartment, and posteriorly, this compartment are separated by the septum. So we used to say the anterior compartment is mainly performing the flexion of the elbow and the flexion of the shoulder joint. So this portion, this compartment, we give the name as the flexor compartment. So the backside the muscle are performing the extension, so we give the name as the extensor compartment. Same transverse section for the forearm. Forearm is the region starting from the elbow to the wrist joint. We go the two bones, radius and ulna respectively, and in between these two bones we are having the interosseous membrane. We got here again the two compartments of the muscles, anterior compartment and the posterior compartment. Again same name as the flexor and the extensor due to their function. Let's talk about the relationship to the other regions of the upper limb. As in this picture we can see the relationship of upper limb with the neck. The nerves and the blood vessels from this region are passing through the axilla, through the axilla inlet and coming to upper limb. Relationship to the other regions, in which the back and thoracic wall, as in the muscles we have already seen that how the muscles are holding it. So here we go to trapezius. After cutting trapezius, under that we got here levator scapula and the two small muscles here, rhomboid minor and the major respectively, and here that is the latissimus dorsi. It's also attaching at the humerus. Relationship of upper limb with the breast. So as we can see here, it overlies the pectoralis major muscle and its axillary tail is going deep into the fascia. Innervation by the cervical and the upper thoracic nerve. Upper limb is having the connection, as we can see that the upper limb complete innervation is coming from the C5 to the T1 level. So these plexes together we call that brachial plexus or brachial plexus, how you want to pronounce it, okay. And above the C5, the C4 level, the nerve is going to innervate your diaphragm, so we call that phrenic nerve. Phrenic actually mean the diaphragm. So when this part here a little bit trouble, or you do a lot exercise with your limbs, then it can also cause a trouble to your diaphragm or vice versa. The upper limb skin patches have been divided by the termination end of the nerves. So that we call that dermatomes. Derm means skin and tomes is sections. So as we learned here, the nerves are innervating from the C5 to the T1, so dermatome will be respectively. So upper later portion of the arm, we can see that C5, we will mostly check over there. On the thumb, we check the C6, on the index finger C7, on the little finger C8, and on the elbow medial side we check the T1. Talking about the myotome, for abduction of the arm at the shoulder joint, checking the C5. At the elbow joint, for the abduction, for the flexion and extension, we're checking the C6, 7 and 8. For the flexion, C5 and the C6. For the C8, we are doing by checking the flexion of the digits. For the T1, we are checking the abduction and adduction of the digits. The last is here the tendon reflexes. So the tendon reflexes, we are checking mainly the tap on the tendon of the bicep in the cubital fossa to check the spinal cord level C6, and the tap on the tendon of the tricep at the elbow posteriorly for the C7. So some important tips you need to take away. All the muscles in the anterior compartment of the arm innervated by the nerve, musculocutaneous nerve. Anterior compartment of the forearm with the two exceptions, median nerve. What are those two exceptions? Are these two muscles? Those are actually innervated by the ulnar nerve. Most intrinsic muscles in the hand are innervated by the ulnar nerve, except for the thin arm muscles in the two lateral lumbricals. They are innervated by the median nerve, and all the muscles in the posterior compartment of the arm and the forearm are innervated by the branches of the radial nerve. Nerve related to the bone. As you can see, the nerves are passing, and here at the surgical neck, posteriorly, you can see the axillary nerve. In the mid shaft, the radial nerve. Laterally, at the epicondyle, the radial nerve also passing over there, and medial epicondyle, we are having the other nerve. So in this point, injury could cause the trouble to the nerve too. This is the skin innervated by the major peripheral nerves in the arm and the forearm, as the axillary, radial, musculocutaneous, median, and the ulnar. So these patches need to remember for the sensory innervation on the skin. And this is the posterior vein. Superficial vein. Veins are going deeply, same route as the arteries, but the superficially they're having the different route, and very, very important for the dorsal venous arteries from the hand going upward, medially and laterally, respectively. We got here the basilic and the cephalic vein. On their course, they are also joining at the cubital fossa, very important, and the famous vein we call that median cubital vein. Okay, very important to withdraw the blood or intravenous puncture. Orientation of the thumb. Thumb is positioned at the right angle to the fingers, so as a result its movements are different from the fingers. As we can see here, the flexion extension performing in this way, and it's also performing another motion, abduction, and here a very important opposition of the thumb with the other digits. Okay, so after learning today's, you could be able to give these 5 easy questions answers. This is the summary of what we learned today. And thank you very much. If you have any question, you can send me email. Thank you. Bye-bye. Okay guys, today we're going to talk about the bones of upper limb. Bones of upper limb, one side, we got total 32. Sesamoid bones are exceptions. So shoulder girdle bones, in which we go to two bones, clavicle and scapula. Arm bone, humerus. Forearm, we go to two bones, radius and ulna. Hand could be divided into the wrist, palm and the fingers. So in the wrist we go to 8 bones. Collectively we call them carpal bones. In the palm we are having the 5 bones. We call them metacarpals. And in the fingers we go the phalanx or phalanges, 14 in number. Let's talk about the shoulder girdle bones. We got here the clavicle and the scapula. Clavicle is representing in the green color and the scapula is representing here in the yellow color. Let's see. Clavicle and scapula. These two bones are making the shoulder girdle. Remember about it. Now we are coming to the arm bone, the humerus. Representing here is in the green color. Humerus, the long bone. For arm bones, we go to two bones, radius and the ulna, representing here in the purple and the red color. In the anatomical position, the radius is the little bone and the ulna is the middle bone. Both are the long bones. Talk about the hand bones. In the hand we go to carpals, metacarpals and phalanges, representing here the green color, the carpal bones, red color, metacarpals, and the blue color representing the phalanges. Talking about the carpal bones separately, carpal bones, total 8 in number, 4 in the proximal row, 4 in the distal row. In the proximal row, from lateral to the medial in the anterior view, in anatomical position, first of all we got here most laterally, scaphoid, lunate, triquetrum, also known as triquetral, pisiform. So talking about the first, scaphoid is a boat shape, lunate, crescent shape, triquetrum, three-sided bone, pisiform is actually the sesamoid bone in the tendon of the flexor carpi ulnaris muscle. Now we are here on the distal row, also having the 4 bones. Number 1, trapezium, trapezoid, capitate, hamate. So let's talk about the trapezium. It is the irregular 4-sided bone. The trapezoid is also 4-sided bone. Capitate is having the head and it is the largest among the carpal bones. Hamate is having the hook very prominent on the anterior side. Talking about the metacarpal bones, there are 5 in number from lateral to the medial side, or you can say from the thumb side to the little finger side. We got here the first, second, third, fourth and the 5th metacarpal. Let's talk about the first, second, third, fourth and the 5th metacarpal bone, total 5 in number. Talking about the phalanges, phalanges are the bones making our fingers, and we are having the proximal phalanges, we are having the middle phalanges and the distal. So talking about the proximal phalanges, we got in all fingers, middle phalanges only in the fingers but not in the thumb, and the wrist reflexes all. So total 14 phalanges we got in the fingers. Thank you.